Welcome back to part 4 of the Inpatient Data Elements tutorial. In this tutorial, we will review the data elements in health metrics relevant to services, including ICD-10 codes. The next services data element is the admitting diagnosis. This field is an ICD-10 code that describes the diagnosis provided by the admitting physician at the time of admission. This field is not to be confused with the principal diagnosis, which is different. This field defines the patient's condition upon admission. The next service data field is a value-added field known as MDC, which stands for Major Diagnostic Categories. This code contains a series of DRG or diagnostic-related group codes, within each MDC. The MDC codes are defined by the CMS and can be thought as a type of product line code. The next field is another value-added field called the Medical Surgical Code. This code shows the ratio of medical and surgical service volumes. This field derives from the MS-DRG code table, where you can find out if the DRG falls under a medical or surgical service category. The next service field is the MS-DRG code. This code represents the assigned MS-DRG code, which stands for Medicare Severity Diagnosis Related Group. The MS-DRG is a code system that classifies Medicare patients' hospital stay into various groups in order to facilitate payment of services. Health Metrics uses the MS-DRG code for all patients in our system, even commercial payers. The next field is a value-added field that shows a MS-DRG product line. This is another grouping of MS-DRGs into another type of product line. These specific categories were developed by another CMS source and are more targeted at medical and surgical services. The next field is a value-added field that looks at the severity of MS-DRGs. These definitions are derived from the MS-DRG descriptions. In this field, we are taking the DRG descriptions that have the phrase "with or without complications" and grouping them into the 4 descriptions you see here. Knowing the severity of patients can help in the treatment of several diseases. The next field is the Principal Diagnosis Code, which is a valid ICD-10 code. The principal diagnosis is the code representing the diagnosis established after studying the patient, and is chiefly responsible for occasioning of admission. Remember that the principal diagnosis is not necessarily what brought the patient to the emergency room or facility, but rather, what caused the admission. The next field is a value-added field showing principal diagnosis groupings. These groupings are ranges of ICD-10 codes that fall into a disease category. There are 20 of these grouping codes that are aggregate and can help you target specific diseases quickly. You can see the 20 groups displayed here. The next field is another value-added field that shows principal diagnosis groupings, but on a more granular level. Here, you can search for ICD-10 ranges that are a subgroup of the principal diagnosis groupings. As a result, you can find those ranges that are specific to symptoms, diseases, and infections. You can get a feel for these definitions here. The next data field is the Principal Procedure Code. This is an ICD-10 code that represents the procedure most related to the principal diagnosis. Procedures can be operations such as bypass surgery, or knee replacements. Keep in mind that a large volume of patients do not have a procedure done during their stay. The next field is a value-added field and focuses on the Principal Procedure product line. These are ICD-10 procedure codes that are grouped into categories for easy navigation. These categories include obstetrics, mental health, and others. The next data element field shows the information in quarters. The Florida data is updated quarterly, and shows quarterly time frames. This is also a good way of viewing to see the latest data in the system. The system defaults to a year's worth of data as shown here, but since the data comes out on a quarterly basis, you can use the quarters option to see how many quarters are present in the year. The next data element shows the year time frame. The year option is self-explanatory in that it shows the data in years. This concludes our examination of the inpatient data elements that are available in Health Metrics. Please check out our other videos to advance your learning of health metrics. Thanks again for viewing our videos.